Hello, welcome to c-meditech Online Academy. Let us do a question discussion based on Haad Pharmacy Technician Examination. So the first question is, a 60-year-old man with glaucoma developed nasal condition. Which drug should be avoided? A. Cetirizine, B. Pseudoephedrine, C. Paracetamol, D. Saline drops. Okay. So in this case, a 60-year-old man with glaucoma developed nasal condition, and which of the following drug should be avoided in this patient? Okay. So while considering the option, you can see that pseudoephedrine. So pseudoephedrine is a sympathomimetic agent. So that causes mydriasis. So what happens when they cause mydriasis? It will raise the intraocular pressure that will further worsen the condition of glaucoma. Okay, so the answer is pseudoephedrine. The reason is that pseudoephedrine is a sympathomimetic agent. Since it is a sympathomimetic agent, it causes mydriasis and raise the intraocular pressure and worsen the condition of glaucoma. So in this case, a pseudoephedrine should be avoided in this patient. Next, question number 2. A patient with type 1 diabetes mellitus asks if insulin can be taken orally. Why is it not given orally? A. Poor absorption. B. Destroyed by gastric enzymes. C. Causes gastritis. D. First pass metabolism. Okay. So in this case, the patient is having type 1 diabetes mellitus and he is asking that can he take insulin orally? Okay. So in this case, can we take insulin orally? No. Why? What is the major reason? It is destroyed by gastric enzymes, isn't it? Since insulin is a proteinaceous hormone, it's a peptide hormone. So what happens is that it will be rapidly destroyed by the enzymes which is present in our stomach, isn't it? Our stomach contains hydrochloric acid. Along with that, there is proteolytic enzymes will be also present. So it will digest the insulin. That is why it is given through subcutaneous route. Since it's a peptide hormone, it is rapidly digested by the enzymes which is produced in our stomach and intestine. That is why it is given through subcutaneous route. So the answer is option B, that is destroyed by gastric enzymes. Next, question number 3. A pregnant woman in second trimester complains of severe toothache. She asks for safest analgesic. Which drug is the safest during pregnancy? A. Ibuprofen, B. Aspirin, C. Paracetamol, D. Diclofenac. Okay. So in this case, the pregnant woman in second trimester complains of severe toothache. That means she is feeling severe pain and she is asking for the safest analgesic to be taken in pregnancy. So in this case, while analyzing the option, in pregnancy, the safest analgesic or the safest NSAID that can be taken during pregnancy is paracetamol. Okay, the main problem of using NSAID in pregnancy is that the premature closure of ductus arteriosus. So, in this case, while evaluating the options, we can understand that the paracetamol does not cause much problem in prostaglandin synthesis. So, it does not cause the premature closure of ductus arteriosus. So, it does not cause any problem in the fetus. So, most safest NSAID that can be used in pregnancy is paracetamol. So, the answer is option C, paracetamol. Question number 4. The child scheduled for influenza vaccination is immunocompromised due to chemotherapy. Doctor considers vaccination options. Live attenuated influenza vaccine is contraindicated because A. Causes fever, B. Risk of infection in immunocompromised patient, C. High cost, D. Requires booster dose. Okay. So in this question, it is given that the child is immunocompromised due to chemotherapy, and here the doctor has consider different vaccination options. So in a severely immunocompromised patient, there is a chance that this live attenuated influenza vaccination contain weakened virus. Okay, so there is a chance that this virus can replicate in severely immunocompromised patient and can cause again an infection. So in this case, it is highly recommended to give, that is completely inactivated vaccine is preferred in this type of patient, that is in severely immunocompromised patient. So the answer is B, that is risk of infection in immunocompromised patient. Then question number 5, a hypertensive patient on nifedipine drinks grapefruit juice daily and develop dizziness and hypotension. Cause A, increased renal excretion, B, CYP3A4 inhibition by grapefruit juice, C, reduced absorption, D, increased metabolism. Okay, so in this case, the hypertensive patient on nifedipine is drinking grapefruit juice and he has developed dizziness and hypertension. What is the reason? So you know that grapefruit juice, it is a it inhibits CYP3A4 enzyme. So this enzyme is mainly responsible for the metabolism of nifedipine. Okay, so when this grapefruit juice inhibit the CYP3A4 enzyme, what happen is that nifedipine will accumulate in our body, and this nifedipine is a calcium channel blocker, isn't it? So what happen when they accumulate in our body? They cause excessive vasodilation that may lead to dizziness and hypotension. Okay, the reason is that the CYP3A4 enzyme is inhibited by grapefruit juice. As a result, what happens is that the nifedipine does not undergo metabolism. They get accumulated in our body that may cause excessive vasodilation, which may lead to dizziness and hypotension. Next, question number 6. A patient using inhaled corticosteroids develop white scrapable plaques on tongue and buccal mucosa. The most likely diagnosis: A. Leukopenia, B. Oral candidiasis, C. aphthous ulcer, D. lichen planus. Okay. So in this case, the patient is using inhaled corticosteroids. Okay, you know the corticosteroids possess powerful anti-inflammatory property. Along with that, they also cause reduction in immunity. Okay, so because of that reduction in immunity, what happened? There is a chance of causing oral candidiasis, that is super infection. There's a chance of causing this infections. Okay, due to this immunocompromisation. So in this case, the oral candidiasis is the major reason. Here, the oral candidiasis is caused due to this inhaled corticosteroid, because the reason is that it will suppress our local immunity. When it suppresses our local immunity, what happened is that the candida will overgrow, that may lead to white scrapable plaques in our mouth. Okay. So the major reason is that the corticosteroid, they have powerful anti-inflammatory property. Along with that, they will lower or reduce our immunity. Because of that, the candida will, this candidiasis, there's a chance of occurring oral candidiasis, because this candida will overgrow in our mouth. Okay, that is appear as white scrapable plaques in the mouth. Next, question number 7. A 60-year-old man develops severe chest pain while climbing stairs. He is diagnosed with a stable angina. The physician prescribed nitroglycerin for rapid relief. Which route provides the fastest relief? A. Oral tablet swallowed. B. Sublingual tablet. C. Intramuscular injection. D. Topical ointment. Okay. So in this case, a 60-year-old man develops severe chest pain while climbing stairs, and he has been diagnosed with stable angina. Okay. And in this case, the nitroglycerin has been provided to the patient for rapid relief. And through which route he is asked to take the medicine? That is a question. So in this case, nitroglycerin when take orally, what happens is that it undergo extensive first-pass metabolism. So to avoid this extensive first-pass metabolism, the nitroglycerin is always advised to take through sublingual route. Okay, so it will be rapidly absorbed through oral mucosa or mucosal area directly to bloodstream and provide rapid relief. So the answer is option B, that is sublingual tablet. Next, question number 8. A patient with infective endocarditis requires a bactericidal antibiotic due to life-threatening infection. Which of the following is bactericidal? Option A, tetracycline. Option B, erythromycin. Option C, amoxicillin. Option D, doxycycline. Okay. So in this case, the patient is having infective endocarditis. That means inflammation in the inner lining of the heart. Okay, endocarditis is there, and he requires a severe bactericidal antibiotic. So by analyzing the option 1 of the bactericidal antibiotic, that is amoxicillin. Amoxicillin comes under the category of beta-lactam antibiotic, and they mainly act by inhibiting bacterial cell wall synthesis. So by inhibiting bacterial cell wall synthesis, they act as bactericidal. Rest all options are bacteriostatic in nature. So the only the one is bactericidal is amoxicillin, which comes under the category of, that is beta-lactam antibiotics. So option C is the answer. Next, question number 9. A 20-kilogram child is prescribed Ticagrelor 50 mg per kg. Available solution concentration is 2 mg per ml. How many ml should be administered? Okay. So in this case, the child is weighing 20 kg and he has been prescribed Ticagrelor 50 mg per kg. So for total this 20 kg, we can know that in this case, the child is weighing 20 kg and 50 mg is given per kg. So total how much milligram we have to given for this patient? 50 into 20, that is equal to 1000 mg. And we know that 200 mg is present per ml. Okay, so 1000 mg is present in xml. When we divide this 1000 divided by 200, we got 5 ml. Okay, so this is very simple. That is, we know that 200 mg. In this case, you can write like this: 200 mg is present in 1 ml. 200 mg is present in 1 ml. So we are giving 1000 mg. Okay, 1000 mg in, we don't know how many ml. So we can write it as xml. So x is equal to, the answer is x is equal to, you can write like this: You can just cross multiply this value. That is 1000 into 1 is 1000 divided by 200. Okay, 1000 divided by 200 and the value will be 5. Okay, this is how you put 5 ml here. Next question, question number 10. A pharmacist mixes 60 gram of 1% hydrocortisone cream with 80 gram of cream base without drug. What is the final hydrocortisone concentration? A 0.25 percentage, B 0.5 percentage, C 0.75 percentage, and D 1 percentage. Okay, so in this case, the pharmacist mixes 60 gram of 1% hydrocortisone cream. That 60 gram of 1% hydrocortisone cream. That means only 1% hydrocortisone cream is present in 60 gram with 80 gram of cream base. Okay, that means here you are mixing 1% of 60 gram. That means the 60 gram of 1% hydrocortisone cream. The 60, when you mix the 60 gram with 80 gram. So 60 gram contain total 1% drug. Okay, so in this question, you are mixing 60 gram of drug with 80 gram base, and the 60 gram drug contain only 1% drug. Okay, so 1% of 60 means what? 1% of 60 means 0.6 gram. Okay, 1% 60, how will you calculate? 1% means 1 divided by 100 of 60. So 1 divided by 100 of 60 is 0, 0 cancel. So you will get only 0.6 gram of drug. You are mixing 0.6 gram. When you mix 60 gram with 80 gram, 60 gram contain only 0.6 gram drug. So total how much? When after mixing you will get total of 140 gram. Okay, so here you have to know the hydrocortisone. What is the final hydrocortisone concentration? What is the final hydrocortisone concentration? When you mix 60 gram with 80 gram, you will get total 140 gram. And of this total 140 gram, only 0.6 gram of drug is present. 0.6 gram is present into 100. Okay, when you divide this 0.6 divided by 140 into 100, the answer will be 0.428 something you will get. Okay, so you can see that in the option, the value which is close to 0.428 is 0.5. So the answer is 0.5. Next, question number 11. A patient with a productive cough requires a drug to loosen sputum, which is an expectorant. Okay, so in this case, the patient is having productive cough and he wants to reduce the viscosity of the sputum so that he can easily expel out the mucus or sputum. Okay, so which can be the expectorant used? A dextromethorphan, B codeine, C guaifenesin, D diphenhydramine. So which can be used for productive cough here? We can give is guaifenesin can be given. Okay, because it is an it is mainly used as an expectorant which can be given for productive cough. Dextromethorphan, codeine, or we can say this is central. It mainly act by suppressing the cough center, and they can be given mainly for this dry cough condition. Okay, and the diphenhydramine, it is having antihistaminic property and is mainly used to reduce cough due to allergy. So in this case, we can give is guaifenesin. It is an expectorant that increases the bronchial secretions and it helps to loosen the sputum, which it make it easier to expel out the sputum. Okay, so the answer is guaifenesin. So this is all about the today's question discussion. For Gulf exam coaching and for data flow related queries, please do contact c-meditech Online Academy. Thank you.